Ladies and gentlemen, hello, and you are watching TTV News with some latest events in Tay Ninh province. And now we come to details. Ladies and gentlemen, a field hospital on the campus of Phuoc Dong Industrial Park, Goya District, is being urgently built to treat patients with COVID-19. The hospital project has been started on July 28.
During this time, strictly following the 5K principle of the Ministry of Health, the workers have urgently constructed the items of the 450-bed field hospital project. The contractor has strengthened 40 motor vehicles to level the road. On August 3rd, the steel truss frame was erected. It is expected that on August 10th, the steel truss structure will be completed. The foundation requires investors to apply the successive construction method so that the treatment areas and functional rooms of the hospital can be constructed. The wastewater treatment system and other items have been also accelerated. Around the 7th, we continue to build the inner foundation, and the team has applied the successive construction method. And 2 days later, we continue to build the partition of the big house. The construction work is expected to be completed on August 20. We are trying for on day and night. Generally, in the last days, we have divided into reserves to complete the plan assigned by the Provincial Peace Committee to Hai Dang Company. 1,962 patients infected with COVID-19 in Tay Ninh province have been treated. Currently, the total number of beds in Tay Ninh province is 4,760.
The continuously complicated development of the COVID-19 epidemic has had a significant impact on the lives of people in Ben Cau district. The whole political system of the district is promoting propaganda to have people receive accurate and timely information, creating trust and consensus in the prevention and control of the epidemic.
In the last day, starting at 7 a.m. every day, the vehicles with loudspeakers have been running continuously on the streets and alleys of the district to propagate and remind people to follow the 5K message well and comply with the social distancing regulations as well as blockade order. Except for loudspeakers, the roads have been decorated with billboards, large banners with propaganda contents about slogans and measures to prevent and control the COVID-19 epidemic, which are concise, easy to understand and remember for people to easily implement. Ben Cau district currently has 236 loudspeaker clusters installed throughout hamlets and quarters. Since the epidemic outbreak, the district has increased the broadcast time of news directly documents from superiors on the epidemic situation to the people. In addition, it has promoted the advantages of rapid transmission of social networks. The district official Zelo and Facebook are continuously updating information on the epidemic situation, contents to mobilize people in order to raise their awareness and responsibility to proactively prevent, control and protect the health of themselves and the community. The Youth Union of Trang Bang District has coordinated with the District Economic and Infrastructure Department to connect with Trang Bang Agricultural Service Corporation and Tay Ninh Businessmen Stock Company or TayNinhTV to deploy mobile trucks of rice stabilized goods to serve the basic food demand of the people. Mr. Hoàng Văn Hữu, Secretary of Tay Ninh District Youth Union, said it has arranged the union's officers to mobile locations for sale so that they remind people to comply with anti-epidemic regulations such as wearing masks, disinfecting, keeping distance and shopping to avoid crowded situations. The essential items were sold at mobile points of sale, including green vegetables up on case, meat, fish, etc. The goods are sold at a stable price to support people in their daily necessities. The operating time at these points of sale will start from 7 a.m. to 11 a.m. daily in the area of block commutes such as Tân Thành, Suối Dây and Tân Châu Thảo due to the temporary closure of traditional markets and supermarkets. It is expected that the mobile sales program will be maintained until the end of the social distancing period.
Turning to other remarkable information, currently in Tay Ninh province, 168 companies in the industrial park and economic zones have been operating under the 3-on-spot option, for maintaining production and ensuring the prevention and control of the COVID-19 epidemic.
Under their difficulties when the COVID-19 epidemic is complicated, the production activities must ensure strict implementation of epidemic prevention and control regulations, but businesses have been making efforts and maintaining their production to supply goods for market and protect workers' jobs. First Team Vietnam Company is one of the companies of TayNinhTV Industrial Park to apply the rate-on-spot option from July 18 until now. According to Mr. Trần Chí Vĩ, Deputy General Director of First Team Vietnam Government Company Limited, TayNinhTV Industrial Park, the company has 2,800 workers. It has been implementing rate-on-spot from July 18. Since the second social distancing order under the Prime Minister Directive 16, about 300 workers did not participate in this option anymore. The company arranged for them to return their homes in Long An. The remaining numbers have been still involved in production. The epidemic prevention still follows the measures of the Department of Health, adheres to the 5K principle, without close contact less than 2 meters. The Department of Health inspection team also confirmed to meet the standards according to the distancing requirements and rate-on-spot implementation. According to the Management Board of Tay Ninh Economic Zone, through inspection and supervision, the enterprises met the condition can maintain production. Enterprises must strictly comply with the approved plan, closely follow the epidemic situation, the guiding documents of the central, provincial, district, and town, to promptly update, adjust, supplement, and organize the implementation of the plan to ensure safety in anti-epidemic work. Take full responsibility for organizing the implementation of the plan contents, ensuring the safety of employees, and minimizing damage caused by the epidemic. On August 5, 2021, Ms. Đặng Minh Lũy, Vice Chairwoman of Vietnam Federal Branch Committee of Tay Ninh Province, and the delegation visited and offered gifts to the blockade areas in Ben Cau District and Trang Bang. On behalf of the Provincial Federal Branch Committee, Ms. Đặng Minh Lũy visited and encouraged the officers and soldiers on duty at the checkpoints of blockade areas, promoting the spirit of leading and trying to overcome difficulties in order to perform the assigned task well. On this occasion, the Provincial Vietnam Federal Branch Committee offered 102 million Vietnam dong to 49 checkpoints of Trang Bang and 2 ones of the blockade area of Ben Cau District, which were deducted from the COVID-19 Prevention and Control Fund of the Provincial Vietnam Federal Branch to support for forces participating in the epidemic prevention and control.
Ladies and gentlemen, facing the complicated developments of the COVID-19 epidemic with many positive cases of SARS-CoV-2 in the area, in the past few days, the Steering Committee for COVID-19 Prevention and Control of Ben Cau District has directed for communes and towns to organize tracing, localizing, and rapid testing of SARS-CoV-2 on a large scale for people in high-risk area. Thereby, it has detected infection cases so that the isolation and treatment measure can be taken timely.
During the fourth outbreak of COVID-19 epidemic, Ben Cau District has many cases of COVID-19 in the community, of which most of the infections were unknown. In order to quickly detect cases, isolate and cut off the source of infection from the community, in addition to implementing specific epidemic prevention and control regulations, the urgent implementation of rapid tests for SARS-CoV-2 for the people in high-risk areas were promptly deployed. With the viewpoint of drastic, fast, decisive, and precise action, the prevention and control of the COVID-19 epidemic in Ben Cau District has been more drastic when the District Steering Committee for Disease Prevention and Control directed the health sector to take the initiative in screening tests for disease sources in the community on a large scale, in which Ben Cau Town and Phan Suối Đá and Bảo Năng communes are the localities that strongly implement this task. After the epidemic broke out in the area, the work of tracing and rapid testing in the community was immediately implemented. Up to this point, the commune has quickly tested for people in 5 out of 5 hamlets, in which Phuoc Dong 2 and Phuoc Dong 3 hamlets are located in the areas with many suspected cases. We have made a large area to organize the second rapid test. Currently, there is no more effective method than the quick test for screening. Until now, F1 cases in Phan commune have no longer developed in the community, but in the blockade areas. During the past time, Vĩnh Châu Town has organized a quick test for all residents. Up to this point, we have implemented a quick test for about 4,840 people. Through the results of quick tests, we have discovered some suspected cases of COVID-19 infection and recommended the district to take them to concentrated isolation to minimize the spread in the community. Although the cost is expensive, the efficiency is very high, serving the locality in the fight against the COVID-19 epidemic. For the COVID-19 rapid test, this is a measure to quickly screen suspected cases in the community. The rapid test will conduct antibody qualitative in medical samples to give test results. After the rapid test and testing processes confirm that the medical isolation and pathological treatment will be carried out in case of necessary. Facing the complicated and unpredictable development of the COVID-19 epidemic, the response to epidemic needs to be raised to a new level, in which the large-scale rapid test will have isolated the area in a timely manner. According to the statistics of the Steering Committee for COVID-19 Prevention and Control of Vĩnh Châu District, by the end of August 4th, the whole district has organized a quick test for 43,573 people, thereby detecting 630 positive cases for SARS-CoV-2. Up to this point, the management and tracing of subjects has been managed by the district, in which the first subject is the people related to F0, then tracing F1 and F2. These numbers have been received the quick test for COVID-19. The second subject is from outside the province, returning to the locality, who will be quickly tested and isolated at home. These two subjects are now very tightly managed by the district. In the last 3 days, the number of positive cases through the rapid test in the blockade area and community has decreased significantly. According to the assessment of the District Steering Committee for Disease Prevention and Control, the safety of Vĩnh Châu District so far is quite high. The management of quarantine people has become more orderly and strictly from the grassroots. Currently, many cases are positive for COVID-19 without symptoms, so the rapid test is an essential community screening tool, saving time with low cost, as well as being able to screen in the community, thereby quickly detecting the source of infection to have a plan to trace and prevent the spread of the disease.
Ladies and gentlemen, that's all for today TTV News. Thank you for joining with us and see you next time.